You're standing at a nurse's station in a busy emergency department. It's 2 a.m. on a Tuesday. A man is coding in Bay 4. His oxygen is dropping. The attending is stuck in surgery. The other residents are buried. Someone looks at you and says, "Go." You go. You intubate him. Clean first attempt. His sats climb back into the 90s. The room exhales. A nurse pats your shoulder. "Good job, doctor." You nod. You say nothing. Because you're not a doctor. You never were. Your medical degree is a forgery you bought for $1,100 from a man in Guadalajara who printed it on a Thursday afternoon. You've known this for 12 years. The man in Bay 4 doesn't know. Nobody in this building knows. And right now, with his heart beating steadily on the monitor, you're not sure it matters. It started with a failed application. You applied to 4 medical schools. You were rejected by all 4, not even waitlisted. Your MCAT score was decent. Your grades were fine. Just not fine enough. Not for the schools you wanted. Not for any school, apparently. You'd spent 6 years working toward this. Pre-med at a state university, volunteering in hospitals, shadowing physicians, writing personal statements about your dying grandmother and what medicine meant to you. All of it. Rejected. Your parents had already told their friends. Your mother had already bought the congratulations card. You sat with those 4 rejection letters for a week. Then you drove to the bank and withdrew everything in your checking account. $2,400. You bought a plane ticket to Mexico. The man in Guadalajara operated out of a print shop on a side street that smelled like motor oil. His name was Ernesto. He didn't ask why you wanted the degree. He asked what specialty. You said general medicine. He said that would be extra because of the verification seals. You paid. He printed. You walked out with a diploma from a school that existed on paper and nowhere else. A transcript. A medical license from a state board whose letterhead Ernesto had copied from a real document he kept in a filing cabinet. You were 26 years old. You had a folder full of credentials that could get you killed, or get someone else killed. You understood that completely. You got on the plane anyway. Your first job was at a rural clinic in West Virginia, a town of 400 people. 1 doctor for the whole county, and he was retiring. The administrator who hired you was desperate. She didn't call the verification number on your license. She probably didn't know there was one. You saw 30 patients in your first week. Sinus infections, hypertension, a diabetic foot you caught before it turned gangrenous. You'd read every medical textbook you could find in the 2 months between Guadalajara and that interview. You'd watch surgical videos online. You'd memorize drug interactions and dosing protocols and differential diagnoses until your eyes burned. You were terrified every single day. But the patients got better, most of them. The ones who didn't get better, you referred out. That was your system. Anything you didn't recognize, anything that felt too complicated, anything that made your stomach drop. You referred. You became known as the cautious doctor, the one who sent people to specialists instead of guessing. Patients like that. They trusted you. They said you actually listened. You listened because you were terrified of missing something. Your attentiveness was just fear wearing a white coat. But the outcome was the same. People left your office feeling heard. You stayed in that clinic for 2 years. In those 2 years, you learned something that no medical school curriculum teaches. You learned the weight of responsibility. You learned that when a patient sits across from you and describes symptoms, they're offering you their vulnerability. They're trusting you with something that could change the trajectory of their life. Every diagnosis you made, every medication you prescribed, every decision to monitor or to refer, all of it mattered in ways that extended far beyond the clinical outcome. Mrs. Patterson came to you with what seemed like a simple tension headache. You did the exam. Everything pointed to muscle tension. But something in her presentation made you pause. You ordered an MRI anyway. She had a small tumor, benign and operable. She called it a miracle. You understood it wasn't a miracle. It was attention. It was the kind of careful observation that comes from absolute terror of getting things wrong. You had no safety net of credentials to fall back on. No prestigious medical school that would soften a mistake. You had only your knowledge and your judgment, and both had to be flawless. That kind of pressure shapes you. It makes you better, or it destroys you. In West Virginia, it made you better. The second job was in Pittsburgh, a community health center in a neighborhood that had seen 4 different physicians in 3 years. Nobody wanted the position. Low pay, high volume, underinsured population with complicated social histories and complicated medical needs. You wanted it because nobody would look too hard at your credentials. You were right about that. You saw 40 patients a day, you got faster. You started to genuinely know things, not just memorize them. You understood how hypertension presented differently in elderly patients. You recognized early sepsis before the labs confirmed it. You learned from every case. You were educating yourself in real time, using actual human beings as your curriculum. You understood that. You kept going anyway. Year 4. A patient named Raymond came in with chest pain. You worked him up. EKG looked okay. Troponins were borderline. You admitted him for observation. The cardiologist on call reviewed the case and upgraded him to the cardiac unit. He had a widowmaker blockage. He got a stent that night. He sent you a Christmas card every year for the next 8 years. You kept every one of them in a shoebox under your bed. Not out of pride, out of something you couldn't name. Evidence, maybe. Proof that the math wasn't entirely wrong. Year 5. A child came in with a fever and a rash. You looked at it. Something tightened in your chest. You recognized meningococcal septicemia from a photograph in a textbook you'd read at 2 in the morning 3 years earlier. You called it immediately. The pediatric intensivist thought you were being overcautious. You pushed back. The child was transferred to the ICU. She survived. She lost 2 toes to tissue death, but she survived. The intensivist called you afterward, said good catch. You said thank you. You went home and sat in your car in the parking garage for 45 minutes. The thing nobody tells you about fraud is that it doesn't feel like fraud after long enough. It starts to feel like your life. Your colleagues think you're real. Your patients think you're real. Somewhere around year 6, you start to think you're real. You know the pharmacology. You know the pathophysiology. You've managed more cases than half the residents at the teaching hospital across town. The degree starts to feel like a technicality, a piece of paper that reflects something true about who you are now, even if it was false when you got it. That's how you keep doing it. That rationalization is load-bearing. You need it to function. Year 7. You apply for a position at a large urban hospital, emergency medicine. The credentialing department is more thorough. They send a verification request to your medical school. The school doesn't exist, but there's a fax number on the documents. Ernesto set it up years ago. Someone answers. They confirm your records. You pass credentialing, you get the job. Your salary is now $210,000 a year. You have hospital privileges, a DEA number for prescribing controlled substances, and full liability coverage under the hospital's malpractice policy. The hospital is ensuring a fiction. You're the only one who knows. Emergency medicine suits you. Fast decisions, clear problems. You don't manage chronic disease here. You stabilize, you treat, you refer. You're good at it. Your patient satisfaction scores are in the top quartile. Your colleagues respect you. You get invited to speak at departmental grand rounds about sepsis recognition. You stand at a podium in front of 80 physicians and talk about early goal-directed therapy. Nobody in that room knows your diploma is sitting in a filing cabinet alongside Ernesto's other work. The applause is real. Your hands shake slightly on the drive home. Year 9. A colleague named Dr. Halverson starts asking questions. Not about your credentials, about a patient. A 34-year-old woman you treated for abdominal pain and discharged with a diagnosis of ovarian cysts. She came back 18 hours later in septic shock from a ruptured appendix. She survived, but barely. Halverson reviews the chart. He says the clinical picture pointed toward appendicitis. He's not wrong. You missed it. A real doctor might have missed it too. Appendicitis mimics a dozen other things. But Halverson keeps looking at you in the hallway. His attention settles on you a moment longer than feels natural. You start taking longer routes through the hospital to avoid him. The near miss changes something. You start second-guessing yourself in ways you hadn't before. You consult more. You order more imaging. Your department director pulls you aside and says your CT utilization is 20% above average. She's not angry, she's asking. You say you're being cautious. She nods. She accepts that. You go home and look up the diagnostic criteria for appendicitis again at midnight, sitting on your kitchen floor reading a textbook like a student. Because you are a student, you've always been a student. The difference is your students don't know that. Year 10. Your malpractice carrier runs a routine audit. A third-party firm contacts your medical school directly by phone. Not the fax number. The actual phone number of the institution. A woman at the firm speaks fluent Spanish. The school doesn't exist. The number goes to a restaurant in Guadalajara. She documents this. The report sits in an inbox for 11 days before someone reads it. Then it goes to the hospital's legal department. Then to the chief medical officer. Then to risk management. A Friday afternoon, 11 years after you walked out of Ernesto's print shop, your department director calls you into her office and closes the door. There are two people you don't recognize sitting in chairs against the wall. One of them has a notepad. The director doesn't look angry. She looks pale. You sit down. They ask you to confirm your full name. You confirm it. They ask where you received your medical degree. You say the name on the diploma. There's a pause. The man with the notepad writes something. The director slides a folder across the desk. Inside is the audit firm's report. Inside is a copy of your diploma. Inside is a photograph of Ernesto's print shop taken from Google Street View. Your face doesn't change. You've been performing calm for 12 years. You perform it now. The next 3 hours are methodical. A hospital attorney arrives. You're told you're being placed on immediate administrative leave. Your access badges are deactivated. Your prescribing privileges are suspended. Someone escorts you to your locker. You take your personal items, your stethoscope, a photo of your dog. The Christmas cards from Raymond are at home already. You walk out through a side exit. There are no cameras at the side exit. You don't know if that's coincidence or someone's small mercy. The state medical board receives the complaint that same afternoon. The district attorney's office is notified by Monday morning. The charges come in layers: practicing medicine without a license, fraud, obtaining employment by deception, forgery. The DA's office pulls every case you ever touched. They're looking for harm. They find the appendicitis case. They find 2 others that could be characterized as mismanagement. They find 12 years of documented outcomes that are, by any measurable standard, good, better than average. This confuses them. It doesn't change anything legally, but it confuses them. You can tell by the way the prosecutor pauses during your arraignment. She looks at you like she's trying to solve something that doesn't resolve cleanly. The bailiff calls the next case. She looks back at her notes.